I'm staying with World Tuberculosis Day. The South African Medical Research Council is leading TB awareness campaigns in Mpumalanga as the province continues to battle with the disease. Now, for more on this campaign, joined by South African Medical Research Council's TB specialist, Dr Awelani Mutshembele. Dr Mutshembele, thank you so much for the time. Appreciate it today. Then let's talk about the significance of this massive launch then and this drive, particularly for the testing of 5 million people per year. As ambitious as it is, still the right thing to do.
Thank you very much for tuning me in. And today it was really a great day, seeing people coming through at Mpumalanga. And it's so amazing that somebody even mentioned that he didn't know about TB. But today we managed to open their eyes, which shows that people out there, the grassroots, the communities, they are suffering because they don't have knowledge, they don't have education about TB. But today we managed to bring people together. We started with men sector that he was talking about men, that men they play a big role in families and also in the community, and also as fathers. And there are those men, sometimes they don't want to go for treatment. They lean on their partners. If the partner goes for tests and say, I'm negative, they think they're also negative, which was very, very good. We also got men, another organization for men to tell men that they must stand up. And also for TB ambassador, people who went through the journey of TB, somebody who relapsed and stood up again and started to move again.
So a lot of this sounds then to me, Dr. Mutshembele, that it's about perceptions, it's about fighting stigma, but also it's fighting the desire to not want to have knowledge. So giving people more understanding about tuberculosis as well. How important is it to be able to do that now, especially since the launch of this drive then by government to test 5 million people a year?
This really, it shows that it was the start of making people to be aware of TB. So we told them that we are going to move forward. We mustn't wait for the World TB Day. As you are saying, some people out there, they don't know, they don't have a knowledge. Some people in city centers, in well-developed countries, well-developed areas, they do have an understanding. But today we managed to see that we really need to go back and really encourage them that if you take it to TB, it's curable. And if you take a treatment appropriately, you'll get rid of TB. And also about the stigma is the most problematic thing, that people, they're still being stigmatized, they're still being called names. But we said, you know what? We are still going to stand with you. We're going to be with you. So we are moving forward. From now on, we'll also ask government to assist us with all this, what we have started. This campaign must keep on going.
It certainly must. I know you're currently in Mpumalanga, as you said as well then. Let's make note of why that area is so critical also then, particularly for TB awareness, TB interventions as well, and what makes areas like that particularly vulnerable?
As I mentioned, it's about lack of education, lack of knowledge, and also the mining sector around people who comes there for mining. There's also a stigma about people that don't want to come out, people that don't want to talk about TB. People, they think TB is something that is not existing. It's something that if you get TB, is something else. So it shows that we need to come out and educate people around Nkangala, around Mpumalanga. And then we want to make sure that we reach that WHO and TB strategy to reduce TB by 50% in 2025. By the year 2035, we don't want to see TB at all.
Yeah, and to be able to do that is going to require a lot of effort and a lot of work from here as well. Is enough money being pumped into organizations like yourself then as well in trying to educate people and trying to make sure that the kind of medication that is needed as well, and then hopefully in what seems to be a vaccine that is seemingly being tested right now still?
If we're still fighting about the stigma of TB, what more about vaccine for people who doesn't even know what TB is? That is very far from them. We still need to educate them with vaccine. As we're saying, we were targeting people from a place whereby we saw that we also invited the pastors, the ministers of churches, where we know that people, they believe on them. So if we are working together with them, they mustn't just preach about, we need to see people healthier. How are we going to get people at church if people are sick? So you need to encourage them that people, you need to come to church, but go and get your treatment. So if we can start there, we don't need too much money because they are going to church every Sunday. So it's something that the pastors, the ministers, all these who encourage, who are praying for them, they must bring in those programs at church. Whenever there are people, they must also teach them that, okay, we are fighting about TB. What is TB? Even other diseases. So then we can roll in the vaccine. Because you can imagine you are confusing them about TB already, about the treatment of getting rid of TB. Then you come with the vaccination. And people, you know that it's not easy to just go to a place whereby they never heard about anything. So you need to bring them little by little. They'll have an understanding. As I'm saying, even the traditional leaders, they were saying, they were so very impressed because they never thought this thing is very serious. So we can see that because if we can encourage the community leaders and say, please talk to your people. Whenever you got meetings, bring all this education to the people. Bring the right people who can talk to them so that they can have an understanding. Some, they were talking about using herbs. Even when they go to the hospital and get admitted, they were not taking the treatment. They were taking the herbs because they think the herbs are the ones that are going to treat the TB. We're not saying that herbs don't treat, but it depends on what we are dealing with right now. So you can imagine the situation. We're not just talking about the normal situation where we can just approach people and say, here, we're talking about the treatment of TB. Yeah. We're talking about the people that we need to take the mindset out of and say, here's the treatment that you can take and it's going to assist you.
Dr. Awelani Mutshembele, we appreciate your work. Thank you so much for this awareness, education, just putting it out there for people to understand as well the significance thereof. TB specialist and scientist then at the South African Medical Research Council, Dr. Awelani Mutshembele, they're joining us. As the TB drive across South Africa is launched on World Tuberculosis Day, the hope is to test 5 million people per year.